It is now time for another edition of Ask a Doc. We do this every week, and it's a chance for you to ask some professionals in the field of the medical field, rather, to help you out.
That's right, and we're very happy to have a brand new doctor joining the Ask a Doc panel of experts, Dr. Benjamin Scott. You're a dentist, and Kevin has talked about you at length because he's been in your chair before, and you've done some work for him. So welcome to Ask a Doc.
Thank you very much. Thanks for having me.
It's a pleasure. It's a pleasure. And we thought, your first segment here, we want to remind everybody, where are you located?
I have a general dentistry practice on Springfield Avenue, and I also work in Rod Sickler Salon. I have a cosmetic dentistry practice open on Fridays.
Okay, very good. So that's where you can find Dr. Scott. And today we thought we would talk about how bad it is to ignore your teeth when you have problems. Like, say, for an example, you have a cavity and you don't get it looked at. And I would think that a lot of people, unfortunately, do that, and there's further problems that can occur, correct?
Yeah, Kevin and Sarah, that's probably one of the biggest things I've seen recently with the down economy and the expenses going up. I see patients coming in that wait until their tooth hurts or wait until their tooth breaks, and unfortunately, it goes from a procedure that could be relatively inexpensive, like a cavity, to something that's a lot worse, like a root canal, a crown, losing the tooth. So it's been kind of my mission over this period of time to encourage patients that, yeah, it is a little bit more expensive to come to the dentist and to come every 6 months, but in the long run, you're going to preserve your teeth and you're going to be more healthy.
Yeah, so, and like you mentioned, because of the downturn in the economy, you are seeing people wait for a longer period of time. What are some of the more common problems that can, I guess, come out of delaying work on a cavity? You mentioned root canal. Are there any other problems that people can run into?
Well, sure. When you have a cavity, it basically weakens the tooth. So there's a very good chance as that cavity gets larger that the tooth could end up breaking. We call them cracked teeth. And that's probably the biggest reason someone comes in. I know I had this cavity. You told me about it 2 years ago. I kept meaning to come in, bit down on something last night, and half the tooth fell off.
Yeah, and it
that's
happens.
Gotta be such a common thing that you hear in your practice. I bit down on something, tooth broke.
But if you could have eliminated that problem.
It's a little bit disheartening because I know I could have done something so small. I call it a lot of times, cleanings are that way, but also little cavities too. It's preventive care. You do the little preventive things and you maintain your health. And
in the end result, you'll end up, I look at it like this. If you ignore something like that, you're going to be paying more in the long run to get things fixed because, I look at it kind of like a car. If you don't take care of your car, you're going to be paying more to get it fixed down the line. And it's kind of like a snowball down the hill. It gets bigger and bigger and bigger and the more problems you're going to have. So if it's a problem paying right up front and getting it taken care of, just know 6 months to a year later, you're going to have a world of more problems too.
Lot more.
Absolutely. And, if I could say one last thing about it, not only is it just tooth decay, but a lot of times this leaving of the plaque around the edges of your teeth can actually affect the general health of the individual. It's been proven time and time again that leaving these plaques and biofilms in our mouth not only affect our teeth from getting cavities and that, but they can affect our entire body, how we feel, cause inflammation. We know inflammation causes all kinds of diseases in the body.
Well, and I was going to ask you, can tooth pain, gum pain, mouth pain, just kind of in that general area, it can be an indicator of something else that might be going on. So taking care of your teeth and your gums, that's really very important.
Super important. You nailed it right there on the head. There's so many things that are related. Everything in the body is related. And there used to be a theory years ago, which everybody knows now, but your mouth was one thing, the rest of your body was another. Well, that doesn't make any sense.
No, it's all connected. Yeah.
And Kevin asked me a couple months ago about child school exams. And the reason those came about and that they've been mandated by the states and that is they figured it out. They proved that these kids that have these untreated cavities, these untreated things, they may not even know it because they're so young, but that hurting tooth, that aching tooth, whatever, it is affecting their performance in school. It's affecting their way of thought. It's affecting their attitude, so on and so forth. It happens to us as we grow up too.
Yeah, it's like that ripple effect. You drop that little cavity in the pond and it just has all these outlying effects.
Yeah, and it also brings back to the point you need to start your dental care at a young age and keep that up throughout. So if you're listening right now to this segment and you have tooth pain or there's something been just gnawing at you, but you're like, you know what, I'm going to put it off.
Don't say gnawing.
Yeah, well, yeah. If you're gnawing on something right now, we're sorry about that. But, if you have that pain, and it could be something more than that, but I guarantee it will turn into something more. So go see your dentist and check it out. Now, if people want to give you a call, how can they get a hold of you?
I think probably the best thing, Kevin and Sarah, if you guys wouldn't mind just putting my email on your website.
And they can contact you through there?
Contact me that way. Fortunately in Champaign, we're so fortunate to have an amazing number of excellent dental care providers. But I would love to be a source for anybody to answer questions, to help them out, to encourage them to get going.
Oh, well, that's excellent.
From what I understand on the website you have for your practice, you have kind of an online Ask a Doc forum going on where people can ask you questions and things of that nature.
Yeah, it's a form you can fill out. That's actually how I was introduced to you guys. I filled out the form, was having some issues, and man, they got, right back with me, and a lot of it's those unanswered questions. That's the problem. So we'll have the link up. You can talk to him, or if you have any other questions regarding your teeth and care, of course, Dr. Benjamin Scott will get back in touch with you. And if you have any questions, just go to the website, mix945.com, and we might even talk about it here on this segment. All right, Dr. Benjamin Scott, thanks for being a part of Ask a Doc. Thank
you both.
Talking about taking care of your teeth. So be sure and do that, and we will talk soon. Thanks, Doc.
Okay, thanks.